There is no one-size-fits-all prescription for building a mentally healthy life. Each child is different, each family is different, and each situation is different. But there are underlying principles that can help us all, as long as we apply them appropriately to our own situation.
We created what we call a framework for family support, a simple diagram that can help all of us, whatever the details of our particular situation. Lizzie will now explain this in relation to an eating disorder, and then I'll come back and show how it can apply to a wide range of mental health issues.
How does a happy, healthy child with so much to live for become trapped by an eating disorder which destroys life? There are many different risk factors that can make someone vulnerable to an eating disorder. For example, these might include body dissatisfaction, being unhappy with how one looks, and self-oriented perfectionism, setting oneself very high standards. One might then experience weight-based bullying and struggle to achieve self-set high standards. These stressors acting on the risk factors might lead to disordered eating with restricted food intake. This might then progress to an eating disorder with life-threatening consequences. The eating disorder can change the way in which our brain functions, our neurobiology, such as altering how we feel when we eat. And this can lead to other types of mental ill health, what are called comorbidities, such as depression, anxiety, obsessions and compulsions. Together, these can form a downward spiral with life-destroying consequences, unless effectively treated. But there is hope. It is possible to break out of this process. I know, because this was my history. Now, in my present, I'm a doctor, using my medical knowledge and lived experience to help others through my role at Family Mental Wealth. We have developed this framework to describe the process of an eating disorder. Although the exact route through will be different for different people, it can be used as a guide to help others, especially for families, who can play an important role at 3 key stages of this process: turning risk into resilience, spotting the signs, and crafting the care.
So that was the framework applied to an eating disorder. Now let's make a change to 2 of these boxes so that it can be useful for a wide range of mental health issues. The disordered eating was the early stages, the initial development of some features of mental ill health. And the eating disorder was the more established ill health, what health professionals would recognise as the clinical symptoms. Actually, these particular words don't really matter. What is important is to realise that mental ill health doesn't suddenly arrive fully formed. It's not like a broken leg where one moment it's not broken and the next moment it is. Mental ill health develops over time.